Coming up today, on a motorcycle and on a mission, one cancer survivor wants his story to spur action in men like him. Good morning, I'm Jessica Lovell. Welcome to the Morning Medical Update. Catching cancer early means a better chance at curing it. That's why doctors recommend regular screenings like mammograms or colonoscopies. Just as important for men is the PSA test. It can detect cancer in men even with no symptoms. I want to welcome to our program today Gary Shorman. We're so glad to have you. He was diagnosed with prostate cancer almost 4 years ago. Thankfully, he caught it early, and now he's on this big mission to spread the word about early detection. So, Gary, good to have you today. How are you?
Hey, thanks for inviting me on. I wish I could be there in person, but what a great subject we can talk about today.
I'm so glad you're going to be the face of this topic, of this conversation. Good to have you, and I know nice to reunite you, I guess, with your doctor here in studio with me, Dr. Will Parker, a urologic oncologist and surgeon with a special interest in prostate cancer. So always good to have you back.
Thanks for having me.
Always nice to reunite our doctors with their patients.
Absolutely.
What was it like when you first met Gary? I have to tell you, when I spoke with him on the phone, I said, this guy has been in radio or television. He's got this amazing voice, and he's the perfect guy to be like spreading a mission, right?
I mean, obviously 4 years ago is a long time, but it was great getting to meet Gary from the beginning, and obviously we've had a great relationship since then. So always good to see you, Gary.
Yeah,
so glad you're here.
Yeah, thanks for connecting.
You know, one of the things just a couple days ago was the 4-year anniversary when you gave me that call. If I have anything, you remember your voice picking up the phone here in Hayes and hearing you tell me I had cancer. And so those sort of the moments that you have along the route, meeting you in person, first conversations we had along the line. But, when you get the word that you have cancer, all of a sudden it raises that interest, that importance to a whole different level. And Doc, you've been great taking me through the journey so far.
Well, that's going to feel good. Doing it right, Doc. So, but Gary, I wanted to ask you, because you brought that up, just that phone call. We ask people that a lot. What was it like to hear the C word, get that phone call? What do you remember really sticking out about the words that Dr. Parker shared with you?
Well, you go along and you have your health history to get there, and I've always been healthy in a sense of trying to be healthy, work out, do all those things to keep your overall body healthy. And so it's like, how can something like this happen? When you're trying to be healthy, you're doing the right things, you exercise, and all of a sudden it's like something just comes out of nowhere and just sort of hits you. It's like that, the surprise automobile accident. You're not expecting anything, but all of a sudden there it is. And so it's that all of a sudden just something in your life kind of takes a real focus on what's important. And then it gets down to, what do you do next? And how do you figure out a way to do the best you can with what you've had? And so when Dr. Parker called, I was sitting in a parking lot ready to get my hair cut. When you're in radio, you got to do your best to look your best. So anyway, I was just in a parking lot ready to get my hair cut, and the phone calls and it says KU on it. And it's like, this must be Dr. Parker. And I'd had a test 4 years earlier, and it came back negative, and I was expecting the same thing this time. And when Dr. Parker told me what was happening, it was very, very straight to the point. It's like, here's what the score is, Gary. You have cancer, and it's serious. And so the next steps are trying to figure out what to do and try to figure out what options you have. And I found, as going along and even looking back 4 years, when you visit with people, you find out there are so many options. So having a good medical team to help you get there and make those decisions is so very important.
Yeah, a lot of good options, and you need someone right to navigate all of that. And the good news is, Gary, you're in remission, but I want to go back just a bit, because you got your PSA levels checked starting at age 50. Was this something that your doctor recommended? Was this something that was on your radar?
It was not on my radar. Had no family history of it, and so it started with a radio show. We did a radio show with a physician out of Wichita, and he was a heart physician. And so I said, Gary, you ought to just get a baseline for what you're doing. And so it started out on the cardiac side of thing. I have a great cardiac history and a good history, and so started doing that. But in the process of doing blood work, he said, just start right now, get your PSA, and then every year check it and see where it goes. And I think my first PSA level was around a little over 1.2, something like that. And then it slowly kind of worked its way up and kind of bounced around at 4 for a while, where I had my first biopsy done. And after that, that came back negative and kind of stayed around that until, I want to say 2018, 19, it started going up. And my local doctor recommended that I go see this guy in Kansas City that was really pretty good at this, and that was Dr. Parker. And so I ended up with a MRI-guided biopsy that found the cancer.
All right, so you were this guy in Kansas City that he had to come see. I want to talk about, I mean, Gary's like, he's a guy in the know, but he didn't really know about PSA. I admit, I hadn't really heard much about it until you and your partner started coming on the show, and I'm learning each time. But explain exactly what PSA and how do we educate men to know to be asking about it in these tests?
Yeah, the first part's easy, the second part's hard. So PSA is a normal protein. It's a reproductive enzyme that's created by the prostate, so it's something that we actually make a lot of. It's just not very much of it should end up in the bloodstream, which is why we use it as a marker for prostate health. So not really for prostate cancer necessarily. You can think about it broadly as just prostate health.
Okay.
How do we educate men about this? That's the harder part. Because often, if your primary care physician isn't telling you or encouraging you, like in Gary's case, hey, let's just get a PSA checked, you should get a baseline done, it may not be on their radar.
So I remember my grandfather died of prostate cancer, and I remember, just hearing through the years, like, well, if you live long enough, you'll get prostate cancer. Well, I don't think people want to live long enough to just find out at 80 years old you have prostate cancer when it's too late. How have things changed, I guess, with this testing and just the education of it and letting men know that these screenings are out there so that they do catch it in time?
Yeah, I think there are two things that have really changed from kind of when your grandfather probably went through this. One is we understand that certainly it is true if you live long enough you will be diagnosed, but often the ones that you diagnose by the time you're in your 80s aren't prostate cancers that are going to harm you. So we understand that there is a kind of class of prostate cancers that don't really need to be treated, that honestly, if we find or don't find, it's not going to impact how long somebody's going to live or how well somebody's going to live. But then there are other cancers that are very important to find early and address early because they are the ones that are likely to spread and cause harm.
So Gary was getting checked at 50. Is there, just like women getting mammograms at 40, is there an age? Is there a magic number? Is there a risk level?
So current guidelines recommend that screening starts somewhere between 45 and 50 for an average risk individual. And then 40 to 45 for higher risk individuals, which would be somebody of Black ancestry, somebody with a strong family history of either prostate cancer or even breast cancer, ovarian cancer, and pancreatic cancers. Those tend to cluster together, and colon cancer, sorry, let me not forget that.
Sure. So does a high PSA always mean cancer?
No, in fact, so again, going back to my statement that it's a marker of prostate health, there are a lot of things that can drive PSA up. Beyond prostate cancer, inflammation, so people who have prostate infections, people who go through trauma, their PSAs can be high. Interestingly, and I know we're going to mention COVID later in the show, we found out during the COVID epidemic that COVID actually caused PSA to go up. So the systemic inflammation that came from that caused PSAs to go very high. So there are a lot of things that can cause it to go up. The hard part is identifying who actually needs that next level of screening to find if they actually do have prostate cancer.
So yeah, so you find out you have high levels. What are those next steps? Your doctor, and in Gary's case, he had a doctor elsewhere that then referred him here. But what do you do next?
Yeah, so the way I approach that first off is to get a bit of a risk assessment. So there are various tools that we can use to take somebody's age, their PSA, their exam, and estimate about how high of a risk are they of actually having prostate cancer. And then, depending on that, we could do some additional testing in the form of some blood tests or urine tests that are more accurate than PSA. Or like in Gary's case, we could get an MRI, look at the prostate, which is most commonly what we end up doing. And then if there is a level of suspicion there, doing a biopsy.
So Gary, before you had surgery with Dr. Parker, you did something that we actually encourage patients to do all the time, which is to go get a second opinion if you feel you need one from another hospital. Why did you want that second opinion? And just kind of take us through that process.
Well, once you get into this, and again, you realize there's so many different ways you can go about the whole process of dealing with prostate cancer, and I found the more input you have, the better off you are to make a decision. And had some relationships with some people at the Mayo Clinic, and so I was sitting in Dr. Parker's office, and I just asked, I said, what do you think about a second opinion? And he encouraged that. And so that was helpful. I really didn't know quite how he would take that. He encouraged that, and so ended up making a trip up to Mayo. What was surprising is kind of the surprising in a sense, I didn't get a lot of different answers. I had the same answers. And the doctors were very supportive. The doctors there were supportive of what was going on at KU and Dr. Parker, because he'd had a working relationship with them as well. But going through that process, you realize you want to have the best care you can have. But if you're also hours and hours away, that all of a sudden the care, you want to have the best care close to home. And KU provided that for me. They had not only had the best care, the best docs, but it didn't make sense for me to go somewhere else. And frankly, they supported the whole discussion that I had with Dr. Parker about my route for getting treatment.
As they should, as they should. And I like what you said, Gary. You're like, I didn't know what Dr. Parker would think with me kind of maybe questioning him or wanting somebody else to kind of back him up. So Dr. Parker, what is the best way for a patient to tell you, hey, I'm going to get a second opinion?
Just ask. I mean, honestly, from a personal perspective, I don't mind when people get second opinions, and what I often tell people is one, I want you to go find out what they have to offer, what they're going to tell you. If it's the same, then it at least reinforces what I'm telling you. If it's different, come back and tell me what's different.
Yeah.
Because that's a way for us to understand maybe what are we doing differently from somewhere else, and to have a dialogue about it.
Well, yeah, and it's easy for you to say, you're like, yeah, no problem. But as a patient, we go to our doctors, we're told to trust our doctors, trust the science and the medicine. But thank you for putting that at ease. But what if a doctor were to come back and say, or a patient comes back to you and says, hey, I saw another doctor and they brought up this aspect or this type of treatment? What are the conversations then?
Well, I think it depends a little bit on, is it something that is medically appropriate? Do I agree with it? Do I think that that's something that they should reasonably consider, in which case we'll have a conversation about it? Or do I have a different opinion? Do I think that it's not within the guidelines, not within the standard of care? And then that may lead to a third opinion, or kind of what happens next as far as the deciding factor between those two. So,
but in your opinion, a good doctor always wants a patient to be armed with the most information,
correct.
Right?
Yes. In fact, the line I often make is that informed consent requires information first. And so long before we ever get to a treatment decision, it's all about information dissemination. That's what has to happen. So
Gary ended up having his prostate removed, and no prostate means that your PSA level is supposed to be 0, but then Gary learned that your PSA was not 0. How did you learn that, and then what were those next steps?
Well, again, the information is so important. So you keep getting your test. In my case, I had tests every 3 months. And so when, mine was close to 0, it just wasn't 0. And so the important factor is then you stay on top of that and make sure if it gets above a certain level, then you start going back in for more serious treatment, which would happen to me. And the whole thing of Dr. Parker talking about the options that are there and getting the information, it's your body as an individual. I don't know if it's a man, woman, whatever. When somebody's operating on you or taking care of you, it's your body. You need the right information to be able to make the decisions that you are comfortable with individually. And so by getting that next step, you have the same doc. I didn't get a second opinion on the sec option. I trust Dr. Parker to do what is best and give me the best recommendation. And so I ended up going back and had a second procedure done, which dropped the PSA back now next to close to 0 again. But we're just staying on top of it. So every 3 months I have a PSA check and just make sure that it is staying in remission, or if something else there, then look at what options are available at that point in time.
So Dr. Parker, how is that PSA creeping back up? You do these treatments and then it creeps back up, or you do a surgery and it creeps back up. What's happening there? So
something has to be producing PSA. And after surgery, what we believe, because we've removed the entire prostate, so all of the benign, non-cancerous prostate's gone, that the only source of PSA that should be remaining would be any cancer cells somewhere. And so then the question becomes is, where are those cancer cells? And so in Gary's case, we go and we search, we do advanced imaging in the form of a PET scan, and we find, okay, well, there's a lymph node, there it is, and we take it out, and then we see what the PSA does. And if the PSA starts to go up again, we'll do the same thing.
It's just a work in progress.
Correct. We'll keep looking for and trying to find where is that PSA coming from. But that's one of the really nice things about surgery in this instance is that because the prostate's gone, we have this absolute value. It is either 0 or it is not. And so it becomes very clean to look and say, do we have a problem? Do we not have a problem?
Yeah, that's good. Let's find out what Gary's been up to. You know, he's been riding the bike.
Oh, yes.
I think he wants to get you on one of them, by the way. But so, Gary, you founded the advocacy group called Alive to Ride. How did you start it? Why did you start it?
Well, probably got started here because in the process of riding my motorcycle, I was on one of the cross-country motorcycle rides, and I happened to be on a 1940 when I was doing this, but we were riding across the country, and I was working with KU to get my MRI-guided biopsy done. And so when you're with a group of guys, you're out riding, the last thing you want to do is stand there and talk about your biopsy and what you're doing. So I snuck off into, I'll call it the ladies section of a Harley dealership. And I'm working, getting things scheduled and doing this. And so what I realized is not only myself, but others, there's a group of, I'll say, knuckleheaded men that they don't want to get their PSA checked. Probably my best case story is I have a good friend who his father has prostate cancer. He doesn't want to get his PSA checked. By the way, that's Marianne. She loves the beard. Anyway, you know, he didn't want to get his PSA checked because he doesn't want to know. And so my story is not to solve the cancer problem, but just to encourage other men to go out and just get their PSA checked. Because the sooner you get it checked, the sooner you can get care, the better your treatment options are going to be, the better you have a time to be out, and in my case, alive to ride. If you like to ride a motorcycle, if you like to ride in a car, if you like to do fun things, you have a chance to do more of that. You have a chance to go out and enjoy life more if you get tested early. If you wait till it's too late, then all of a sudden those options are away. So being alive to ride, that's where that started. And the goal is to just encourage men to get their PSA checked. And it's a simple story, but I've had some very interesting feedback from people along the route that have come up and said, here's what happened to me, here's where I am, what do you think of this? And, you know, all those sort of questions that come out of men once that you have a chance to say, hey, it's important to do this, and people start having the discussion back and forth. And that's what I'm hoping will happen with Alive to Ride.
Yeah, Dr. Parker, I'm imagining Gary out there talking about prostate health while they're out on the road trying to, you know, fixing their, tinkering with their bikes. And here's Gary saying, hey, have you got your PSA checked? Not quite what you would expect with a bunch of cool bikers, if you will. But when you hear that story, though, that's exactly when we talked about education at the top of the show. It's like that's exactly what we're saying. You have to have this kind of unicorn that comes out of nowhere, like Gary, yes, that says, hey, I'm going to get you all on your bike. And then guess what we're going to talk about?
Absolutely.
So cool. It's so cool. And I understand that you may expand your advocacy to another hobby of yours, maybe Alive to Fly. Is this what I'm hearing?
Well, I have several things you can do, and men are not just exclusive to, yeah, that's my airplane. And I'm in the process of building one as well. You never say never. At one point, that's the plane that I'm putting together, about 10,000 parts that I'm working on. But the idea behind it is that, you know, there are men out there, again, just tell the story. I was sitting on a motorcycle in a line to take pictures, and the guy next to me was an older gentleman. Not that I'm not old, but there's an older gentleman sitting there. He said, Gary, he said, I had my prostate out 11 years ago. Keep telling your story. And again, that's all he ever said to me the whole time about doing that. But 1 in 8 of us, men, have prostate cancer. So why not at least tell the story and encourage people to get checked early? So riding motorcycles is one thing, but Alive to Golf, Alive to Fly, how do you get the story out? To just remind people when they go get their medical tests, they want to be healthy, just get a PSA check. It's not expensive to do. In fact, many cases, it's just an add-on test that you check off. Get that checked. But there aren't, knuckleheaded men aren't only riding motorcycles. They're doing other things as well. So if you can expand that story and tell more, encourage more men to just get their PSA checked, that's the goal of it.
So you expanded your story out to Arrowhead because Dr. Parker got you on the field out at Arrowhead Stadium for the crucial catch games. Why did you pick Gary for this?
I mean,
obvious, besides
correct.
the obvious.
I mean, the advocacy work that Gary does is singular.
I love you guys.
And yeah, that was such a fun night. And so, I mean, it was an absolute no-brainer. I mean, you know, Gary has really advanced prostate cancer health beyond just his own, and so that's why.
Love it. How was that experience, Gary, being out there, again, sharing your story, on another platform?
Well, it's when you're out there, and there were other cancers there as well. And I think it's just prostate cancer is one because it's focused on there's a pretty simple test to get done, and it's simple to take the test and you can find out and get ahead of it instead of being behind it. So being out on the field with everybody else and others that have different types of cancers, that was pretty humbling to be out there. The other thing that I happened to be out there in that whole process, meeting Chris Jones, what a big individual he is, and how loud it is on the field. I don't know if Dr. Parker felt the same way, but you're down on that field and you can barely hear yourself think. And then we head out on halftime and do that. Kind of a surreal moment, but it was a lot of fun. And I really appreciate Dr. Parker inviting me to go along for that experience because it's once in a lifetime. I'm not going to play football, but that's probably as close as I'll get to the 50-yard line right there.
I love that. I love that. Was it pretty cool out there?
It was amazing.
Amazing experience. Okay, hang tight, Gary. Be sure to ask your questions or use the chat on YouTube or Facebook. You can tweet us. Email the Medical News Network. Info is right there on your screen. Let's get a quick check on our COVID count. Dr. Dan Hawkinson, good morning.
Hi. Yeah, hi.
Hey.
Good morning. Should be nice out today, too. Very
Good.
good weather. So overall, we have 15 active patients in the health system, so that is good. Hopefully, we can keep these numbers low, but I think we're much happier than even when we're up in those low 20s as well.
All right, question for you. Saw a new study about an antiviral pill that appears to help COVID patients regain their smell and taste more quickly, and you're going to have to make sure I pronounce this right. Ensitrelvir?
Ensitrelvir. I mean,
I
I
was
think
so
with
close.
any of these generic names for these drugs, yeah, just find a couple syllables and put those together.
That's why
I don't know if there's one right pronunciation, maybe until we hear it on a commercial, which we know we see those drug commercials
until then,
all the
I'm going to
time.
butcher it, and that's why you're here.
Yeah,
that's why
absolutely.
you're here. So what does it do? Are patients really still dealing with the loss of smell and taste when it comes to COVID, down the road?
I think they are. I think that is a common symptom and has been identified as a common symptom since the pandemic began. So this is a drug, and it's an antiviral drug. It's a pill. It is kind of like Paxlovid, but it's a little bit different in the fact that it's easier to take. It doesn't have the taste, the metallic taste that people get. But it is not available here in the United States. It was emergency approved in 2022 in Japan, where it was identified and manufactured. There is an FDA fast track now to review all the data, maybe get more data, and maybe allow it to be prescribed in the United States. But as of right now, it's not available in the United States. What it showed, the big thing with this is that it showed that people were able to maybe recover their loss of smell and taste a little bit quicker than if they had not gotten the antiviral. Again, this is for people who have active COVID. We know that when you get it, a lot of the early symptoms are loss of smell and taste. So what they found was that fairly soon after starting to take the medication, about 30 to 40% of people had quicker resolution of that problem, and they could start to smell and taste again. But by about 3 weeks after the initial infection, really all of those groups were the same, and everybody had the same kind of score, if you will, because they were scoring the loss of smell and taste. So initially, I think it helps, but in the long run, it doesn't seem to have too much of an effect. But I think the main thing here is, especially I think what the FDA is going to be looking for, is how well does it reduce the risk of hospitalization and severe disease and death. And we know that Paxlovid does that very well, but we will be awaiting their review and see if it does get authorized use here or approval here in the United States.
All right, Hawk, thanks so much.
Yeah.
Let's get questions from our viewers. Jean's got a couple. Dr. Parker, what was the second procedure that Gary needed?
So it was removal of a lymph node.
Gotcha.
So
okay.
a recurrence.
Okay, so what does that entail?
So, I mean, that's very specific to where the lymph node is. In his case, it was a robotic procedure. Certainly, Gary, I'm assuming you're okay with me talking about this.
Yes.
It was a robotic procedure to remove a lymph node recurrence that was a little bit higher out of where I had done his original surgery.
Gotcha. Okay. And then Jean has another question. Very important question for you, Gary. Wants to know if you have read Zen and the Art of Motorcycle Maintenance.
I have read that.
I figured you had.
And frankly, it's a pretty good story about it. And my last ride was across the country. It was 3,800 miles and 97-year-old motorcycle. You saw it in some of the photos.
I want to see those pictures. Can we pull those pictures up?
And so you have a 97-year-old motorcycle, but it's not so much the motorcycle, it's the people that you get to meet along the way, the people that are in these small towns on 2-lane highways. You don't listen to news, you just are out on the road, you're focusing on being safe, you're focusing on finishing the race. And when you're out there, you just get to meet so many great people who are part of the motorcycle world. But it's people in the communities that make a difference. And so that part of it is probably the biggest thing. And that book talks a little bit about the adventure of just being out there, being with friends, meeting people and doing that. And the motorcycle cannonball, which I was a part of, it was just a phenomenal experience. I'm not sure I'm going to write a book. I shouldn't say never, because I had said I'd never fly in a plane that I built, and here I'm building an airplane. So never say never.
Yes, do not count yourself out. Jenna wants to know, Dr. Parker, what is considered high risk for prostate cancer? She's just trying to find out if this is something her husband needs to be aware of and presenting to the doctor.
So when we talk about high risk in prostate cancer, there are kind of two ways to think about it. So one would be high risk for development of prostate cancer, which would be somebody, again, with a strong family history of prostate cancer, multiple family members with related cancers like breast cancer, ovarian, colorectal, pancreatic cancers, and then black men are at a higher risk. So that would be one way to think about it. The other way that we often talk about is once you've been diagnosed with prostate cancer, there is a category of high risk disease, excuse me, which is based on the disease features themselves.
Okay, question. Does removing your prostate stop you from being intimate? What are those effects?
So anytime we treat the prostate, so I'm going to make it a little bit more generic. Doesn't matter surgery, doesn't matter radiation,
okay,
there's going to be some impact on intimacy.
Okay.
First off, the prostate's a reproductive organ, so if we treat the prostate, there is no more reproduction. For most men who are diagnosed, they're late enough in life that that's not necessarily a concern, but there are impacts on sexual function. So erectile dysfunction is a very common impact after treating prostate cancer. Again, doesn't matter how we treat it. The important thing is that impact can be treated. There are ways for us to address long-term issues with erectile dysfunction. It can just take time for that to kind of ferret itself out and figure out what needs to be done.
So do you think that's why men just don't want to know?
I think that's one of the reasons.
Because it's that area?
That is certainly one thing that a lot of men really kind of hold tightly onto as one of their driving concerns for prostate cancer treatment.
They don't want it to be messed with.
Correct.
For as long as they can, stand it, and then sometimes that's too late for really good treatments. I want to get to our takeaways today, and Dr. Parker, I'm just going to start with you. What do you want anyone who's watching, listening, to take away from this conversation?
I think the two big takeaways, one is get your PSA checked. The only way to know if you have a problem is to look for it. The second is as kind of a theme from this, is information. So if you're facing a medical decision, doesn't matter if it's prostate cancer or something else, the important thing is getting all the right information. And if you don't feel like you're getting all the information you need, seeking out that second opinion, seeking out whatever you need to get the information to make that decision.
Well said. Thank you so much for all your great info today. Gary, wrap us up. What is the one big takeaway from your story that you want folks to really hear?
Well, what I thought about when I was laying on the white table getting scanned to see how far cancer had spread, you got thinking about those things that you want to do with the time you have. And so the sooner you get checked, the more time that you have to be able to do the things you want. And so it started with the Alive to Ride. But frankly, if you want to be around to see your grandkids, if you want to see life happen down the road, the sooner you get your PSA checked, if there's an issue, you can deal with it sooner rather than later. Because being alive to ride is great. Being alive to love, being alive to give hugs to your family, that's the most important thing. So for men, get your PSA checked. It's an early indicator of checking to whether you're going to be alive to do those things that you want to do. Get that checked. Get it checked now.
All right. Keep using that amazing, beautiful voice of yours, and be loud and be proud. And thank you so much for sharing your message. You're going to save lives. We appreciate you. Thanks to all of our guests. Thanks to our viewers for being with us today. We'll see you back here tomorrow at 8. Living with epilepsy means never knowing when the next seizure will strike. I'm Jessica Lovell on the next Open Mics with Dr. Stites. What happens when you treat the seizures at the source? Meet one man reclaiming his life thanks to a unique brain implant. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.